history with respect to her breasts. So all these procedures that I'm about to tell you she's had done by a previous surgeon. In 1992, she had breast augmentation with saline implants. And in 1999, she developed capsular contraction or scar formation around her implants. So at that time, the capsular contracture was dealt with, and she had her saline implants replaced to silicone implants in 1999. And then subsequently, in February of 2022, she developed capsular contracture yet again, and that's when she came to see me. And so when I saw her, I noticed that the left breast, if you notice that the left breast, the shape is a lot different than the right side. She has a little more rippling. And so what we had talked about is removing her existing silicone implants, putting in more cohesive silicone implants, and then also doing a capsulotomy. Now, the intention was to take her implants, if they were above the muscle, and go below the muscle to try to minimize the chance that she would have developed capsular contracture. However, her previous surgeon performed quite an aggressive dual plane, which left me with no muscle to use. And so it put me in a little bit of a quite a difficult situation during surgery. So some of these revision procedures can be quite difficult and challenging. And so we did the best with whatever we had to work with. And so what we did was capsulotomies. We kind of cut through the capsule, softened the pocket, and basically tightened down the pocket a little bit to improve the overall shape. We used more cohesive implants. In this case, a 520cc gummy bear or extremely cohesive implant to help with the rippling. And then she also wanted to be a little bit larger, so we were able to achieve that by putting larger implants in. So you guys can see in the after photos, the breasts are much more symmetric. Some of the discomfort and pain that she had on that left side is significantly improved, and overall shape is better. So we've made it functionally better for her. Her pain has gotten better, and aesthetically, her breasts are a little bit more symmetric than they were before. Just a little bit about capsular contracture. Capsular contracture can happen whenever you have implants in place, whether they're saline implants or silicone implants. And really, there's a couple things that we can do to try to minimize capsular contracture. But frankly, even with the best surgical technique, and even placement of the implants below the muscle, capsular contracture could still occur. It is a rare phenomenon. It's not something that happens quite often at all. But if in the unlikely event that it does happen, there are certain FDA companies such as Mentor, Sientra, and Allergan that have warranties on capsular contracture, which help with financial assistance towards surgery. And I think that's very important for people out there to understand that although capsular contracture can happen, there's definitely financial assistance if you have implants with any one of those companies. It's something that, again, in the first 10 years of having implants for primary augmentation, the risk of capsular contracture is extremely, extremely low. But possible, and if it does, we deal with it. And that's why a lot of these breast revision cases can be a little complicated because it's important to get information. Were the implants initially placed above the muscle? Are they below the muscle? Is this the first time capsular contracture? Is it a second time capsular contracture? How many times has that person had surgery with previous surgeons? So there's a lot of things that go into planning surgery the subsequent time to try to minimize the chance that, and maximize the result, but also minimize the chance to develop further capsular contracture again. I always tell patients that no matter what surgery I do, if you've had multiple capsular contracture, there's always a possible risk of developing capsular contracture. That risk is low. It's not extremely high, but it's certainly possible as long as you have implants in place. So hopefully that was helpful. Thanks for tuning in. I appreciate it. And until next time.